folks, Dr. Fawaz Albadani from the Wellness Way in Pleasanton. I just wanted to take this moment to talk about a very, very important topic, and that is thyroid and thyroid function and how thyroid works and the importance of thyroid for our health and overall well-being. Now, what I've noticed that in my own office, a lot of thyroid problems go undiagnosed or misdiagnosed. And there is in fact over 30 million people in the United States alone who are suffering with thyroid problems. And 80% of those people are actually women. But now, as you see on this overview right here, we're going to dive deeper into the function of the thyroid and where the problem could happen, causing thyroid problems and issues that way. Now, let's take an example. Let's take a person, and we'll call this person Maria, for example. Now, Maria would come into the office and she would suffer problems like overweight, constipation, feeling cold, and mental fogginess. Let's say she would suffer that her hair is thinning and falling, dry skin, and so forth. That is just to name a few of the symptoms that are associated with thyroid problems specifically for this video. We're talking about underactive thyroid gland, or what we call hypothyroid. Hypothyroid, where the thyroid is not producing enough thyroid hormones into the body. Now, why would Maria have such symptoms? Let's take a look. If you see here, what we have here, the thyroid gland. Thyroid gland makes a few hormones, but we're going to focus today on two hormones, T3 and T4. Now, when the thyroid gland makes T3, T3 is the active form of the thyroid hormones, and T3 actually gets transported into different cells in the body, and it enters those cells specifically to activate the mitochondria to make ATP, or energy. So why do we need energy? Actually, we need energy for all body functions. We need energy to grow, we need energy to function, we need energy to regrow skin cells, hair cells, we need energy for digestion, we need energy for hormone functions, and so forth. Now, if somebody is suffering with hypothyroidism, where there are not enough thyroid hormones in the body, now, because we don't have enough thyroid hormones in the body, we're not going to make enough energy for all these body functions. That's why Maria would be suffering with these symptoms. Now, but let's take a closer look at medically what's been done when it comes to the thyroid function. Now, if you go to your medical doctor or primary doctor and they are looking into your thyroid function or your thyroid gland, they would actually do one test, just one test, and they would test your TSH, which is called thyroid stimulating hormones. Now, let's look at different patterns where thyroid function could be compromised, but actually TSH, which is the thyroid stimulating hormone, is still normal. So let's go into this overview of how the thyroid functions. So we have, of course, the brain, where we have the hypothalamus, and the hypothalamus releases TRH, which is thyroid releasing hormones. Now, these hormones travel to that pituitary gland, telling the pituitary gland to start producing TSH, which is thyroid stimulating hormones. Now, thyroid stimulating hormones go into the thyroid, and now the thyroid is going to start producing or making T3 and T4. Now, for that to happen, we're going to need a protein called thyroglobulin, and now the thyroid is going to absorb or take in iodine, and that iodine is going to get into the thyroid, which we call iodine entrapment, and now these two things, thyroglobulin and iodine, are going to combine to make T3 and T4 with the help of TPO, which is an enzyme to actually make that chemical processes to happen, so we end up with T3 and T4. That's the basic of it. That's the basic of it, and that's what you need to know thus far. Now, like we mentioned earlier, T3 is the active form of thyroid hormones. That's the form that the body can use, and it can get into the cells to activate the mitochondria and start making ATP. T4, on the other hand, is inactive. That means T4 has to be converted into T3 for the body to use it. Now, if you look at the percentage right here, we have T3. Thyroid makes about 7% of its thyroid hormones is T3. 91% of its thyroid hormones are T4, and there has to be a conversion that goes from T4 to T3. But let's take a look at what happens after we make T3. Now, T3 has to be transported into the cells, and that process happens through or using thyroid binding globulin. If you think of thyroid binding globulin as taxi cabs that actually carry these T3s inside them to transport them through the bloodstream into the cells themselves for the cells to start using them. And that's good. And we'll talk about what could impact thyroid binding globulin to increase or decrease their numbers in the body, which could impact thyroid function overall. Now, what happens with T4? Now, T4, on the other hand, has to be converted to T3. Now, T4 has to be converted into T3 in mainly two places. The liver, 60% of T4 is going to be converted into T3 in the liver. Now, for the body to utilize and uses thyroid hormones, that means we have to have a very good liver function. Now, if you've watched some of our cholesterol talks we posted, is we talk about how the mechanism of cholesterol lowering medication works by damaging the liver. It actually damages the liver. Now, if the liver is damaged, that means that conversion of T4 into T3 in the liver is not going to be as sufficient, and you won't have enough active T3 thyroid hormone to be used in the body. And as a result of that, you might actually present with hypothyroid symptoms, even though your thyroid is working properly, even though you're making T3 and T4, but the conversion is not happening. Now, another place where the conversion happens is in the gut. Now, in the gut, that is 20% of T4 is converted into T3, the active form. Now, lots of Americans have gut problems. Gut problems are very, very prevalent in our society nowadays. And that goes back to a variety of problems. It could be infections, it could be overuse of antibiotics, and so forth, damaging the mucosal lining of the gut. And now the conversion of T4 to T3 is not happening as efficient. So to have a thyroid functioning properly and thyroid hormone conversion happening, we have to have a good functioning liver and a good functioning GI tract. 20% of T4 is converted into reverse T3. Now, reverse T3 works kind of like an opposite to T3. So if we have a lot of T3 in the body, we don't want those T3 to overwhelm our body, because we can go from hypo into hyper, where we have too much thyroid hormones, and the opposite end of the spectrum, where we have lack of sleep or insomnia, increased heart rate, and so forth. But to modulate that, we have reverse T3, which actually fights T3, or actually compete with T3 on the receptor sites at the cell level. So now T3 cannot get into the cells, and overstimulate them. So that's what reverse T3 does. Now, hopefully that gives you a good understanding of what the thyroid function is and how it works and so forth. So primary, your if you don't have enough T3 and T4 in your body, mainly T4, now your body is going to signal your brain to start producing thyroid stimulating hormones. Now that thyroid stimulating hormone is going to tell the thyroid to start producing more T4 and T3. Now, if you don't have enough T3 and T4 in your body, which means hypo, that means your thyroid is not working properly, when you get tested, your TSH level would be high, indicating that there is more messages that are going to your thyroid, telling the thyroid to work and to make more T3 and T4 because there is not enough T3 and T4 in the body. Now, the opposite end of the spectrum is where you have too much T4 and T3. Now, signals are going to go to the brain, telling the brain that we have enough T3 and T4. Now, the brain is going to reduce the signaling, or specifically TSH, to stop the thyroid from making more thyroid hormones. And that's, if you have your TSH is low on your blood test, that means you're hyperthyroidism right there. But the focus today is on hypothyroidism right now. So if you see here, I've just listed 7 patterns where your thyroid may underfunction itself, or your body might present symptoms like hypothyroid symptoms or conversion, or there is a problem along this pathway that could lead to lack or decrease in thyroid hormones in your body, presenting with symptoms like hypothyroid problems, but your TSH is still normal. So when you go to your doctor and get tested, they'll tell you that your thyroid is functioning properly, and these problems that you're experiencing from fatigue, tiredness, need for more sleep, digestive problems, weight issues are all in your head, and you're going to be put on psychiatric medications. But let's take a look at these patterns. Now, if you look at this here, hypothyroidism, number 1, hypothyroidism due to secondary pituitary function or pituitary stress, right there. So, now what could stress your pituitary gland right there? A few things. First, stress. Could be physical, chemical, or emotional stress that put a lot of tension on your pituitary gland. Now, it's actually, it's under a lot of stress, and that could eventually, because the pituitary gland is overworking and overstressed, it actually also increase the production because it's been stressed for a long time, it's been producing a lot of TSH. Now, it actually drops the production of TSH. The other reason is postpartum, because now after pregnancy, now the hormones are all over the place and the pituitary gland is stressed out and so forth, and it's tired. Now you have less TSH being produced. When less TSH being produced, now your thyroid gland is not making T3s and T4. Sometimes thyroid medications. Sometimes you could be put on thyroid medications with no testing, and those thyroid medications just give your body that T4 specifically in this case. Now, when you are given thyroid medications, sometimes without testing, your body is over bombarded with these thyroid hormones. Now, because you've got a lot of thyroid hormones, your body is signaling your pituitary gland that we don't need any more thyroid hormones, and that leads to lower TSH. Now, lower TSH, if you remember from earlier, it indicates that you have a lot of thyroid hormones and you should be experiencing hyperthyroid symptoms. But in this case, where you have hypothyroid symptoms, but it's due to stress on your pituitary gland, from stress, like we said, physical, chemical, or emotional, which makes the pituitary gland to work extra hard in the beginning, but chronically decreases the function of your pituitary gland over time. And right here, thyroid medications could lead also to resistance. That means you've got a lot of thyroid hormones in your body, and now because your body is overwhelmed, that these cells eventually start developing resistance against thyroid hormones. They don't get into the cells as easily. So this is the first pattern. Second pattern is what we call primary hypothyroid. Primary hypothyroid is where truly the thyroid is not functioning. Truly the thyroid is not producing T3 and T4. And that's the only time where you present to your doctor with hypothyroid symptoms, and your TSH is increasing or high to confirm that diagnosis. Now, with this diagnosis right there is the critical thing about this: what causes the thyroid to be underactive, not make enough T3s and T4, is one of the major thing that could cause the thyroid to go underactive is autoimmune diseases. Autoimmune diseases where the body has developed antibodies against the thyroid, attacking the thyroid, damaging the thyroid, killing those thyroid cells, and now the thyroid is not making T3 and T4. Now, if you have high TSH on your lab results, your doctor is going to give you thyroid medications, and those thyroid medications, the purpose of them is not to work on the thyroid, but also it substitutes those hormones that your thyroid makes. Now, those hormones, it would actually, in the beginning, you might actually feel good and so forth, but over time, your symptoms may come back, and sometimes even worse. Because if your body is developing antibodies attacking the thyroid, now that thyroid cells get damaged more and more and more. Now you need more thyroid hormones and more medications, eventually to the point where your thyroid is completely damaged, and there is no chance for you to reverse or save your thyroid. So this is the only time where your thyroid stimulating hormones are high due to hypoactive thyroid gland right there. But the majority of the problem, it is due to an autoimmune diseases. So this is it's not a thyroid problem. It's an immune system problem. So we have to stop that insult. We have to stop that damage and the attack on the thyroid to preserve the thyroid. Because if we don't, thyroid will be gone, and you're going to need medications for the rest of your life. Number 3, it's an underactive thyroid, but this time the thyroid is underactive due to a stressed adrenal gland. Now, when the adrenal gland is stretched, which is the thyroid sister gland, the adrenal gland is stressed. It actually increases stress hormones, which is cortisol, and now because of that, the conversion from T4 to T3 does not happen. Now, conversion from T4 to T3 does not happen, which now indicate that you do not have enough T3 or active thyroid hormones in your body for your body to use. But if you notice that you could have normal level of T4 in this pattern right there, and now your brain actually does not respond to the number or the amount of T3, it actually responds to the number and the amount of T4. So if you have enough, or you have a lot of T4 in this case, now your brain is getting the signals that we have enough T4, so it doesn't have to signal the thyroid to make more T4, but the conversion is the problem right there. And when you get your TSH tested in this scenario right there, your TSH is going to be normal. Another thing I wanted to point out in this pattern is mercury. Mercury could also stop that conversion of T4 to T3. So if you have any fillings that has mercury in them, that could actually inhibit that conversion and cause problems as well. Now, the 4th and the 5th patterns are really connected. So the 4th pattern is overconversion. Overconversion, that's when we start converting more of the T4 into T3. And when we convert more of T4 to T3, now we have a lot more T3 in the body, but not as much T4 right there. This here, if you look at it, and going back to this, that means we're not going to have as much T4. Now the T4 is going to go back and signal the brain to make more TSH to stimulate the thyroid, but that does not happen. And I'll show you exactly why in a second. But because in this pattern right there, if you get tested, your TSH is going to be normal. Now, like I said, number 4 and number 5 are interconnected. Now, number 5 is under production of thyroid binding globulin. Remember we talked about the taxi cap that carry thyroid hormones into the cells? When we have underproduction of thyroid, we don't have enough taxi caps or thyroid binding globulin to carry these thyroid hormones into the cells to use it. Now we see these two patterns. more prominently with people with insulin resistance and also with PCOS, where testosterone is high. And now, because of testosterone is high and insulin resistance, it actually correlates with thyroid binding globulin actually being less. So we don't have enough thyroid binding globulin, we don't have enough taxis to carry thyroid hormones into the cell. Now you start presenting with thyroid hormone or with thyroid-like symptoms, and even when you get tested, your TSH still in the normal level. Number 6 right there, it's the opposite of what we talked about right there, overproduction of thyroid globulin, thyroid binding globulins right there, where these taxi-caps are too much of them in the body. Now they are going, when we have a lot of them in the body, that means these thyroid hormones are bound to these thyroid binding globulins. When they're bound to these thyroid binding globulins, they cannot detach to go into the cells, because we have a lot of taxi-caps right there that are just holding on to T3 in this manner, and now they're not allowed them to go to the cells. And because of that, you still present with hypothyroid symptoms, even though when you get tested, your TSH is still normal, Now, this pattern here, I just wanted to throw it out there, is what we call is if you have any metal toxicity in your body, this pattern here, when you have metal toxicity in your body, that could actually interrupt the thyroid function, interrupt the thyroid conversion. So to name a few, if you go back up here, we said when your TSH gets into your thyroid, when it gets to the thyroid, it actually, the thyroid is going to start absorbing iodine to make T3 and T4. But iodine, if you look at the periodic table, iodine is in the same column as other elements like bromine, fluoride, and chloride. Now, these components right there, bromide, fluoride, and chloride, actually can compete with iodine from getting into the thyroid, and because of that, we can't make enough T3 and T4 because of the competition right there. And when you get tested, if you have metal toxicity in your body, and now when you get tested, your TSH would still be normal. So we just talked about some of those patterns, and there are more patterns, but we just talked about 7 different patterns. Out of all these 7 different patterns, the primary hypothyroid is the only pattern where thyroid hormones, where the TSH is actually elevated, which correlate with the hypothyroid symptoms. But I want to point something that TSH is not even a thyroid hormone. If you notice, it's actually produced in the brain. So TSH is not even a thyroid hormone, and to use that as an indication of how your thyroid functioning is not enough. So what we do in the office, we test for a very intensive and extensive test to see exactly what's going on. We test things from ferritin to make sure that you're not anemic, because that could be a problem. We test your vitamin D3 level in your body. We test your TSH, of course. We test your T3, total T3 and free T3. We test T4, total and free. We test if there is any antibodies against the thyroid peroxidase right there, TPO. We test if there's any antibodies against this protein, thyroid globulin, that actually is destroying the thyroid due to an autoimmune diseases. We test for reverse T3 and to make sure that we have how high and what's going on there. All these are going to give us a better understanding what's going on with your thyroid. Now, all of these patterns and other patterns, there is a different strategy and a different approach to manage and probably reverse and fix, if caught in time, thyroid problems. But if you notice that everybody's different. So 2 people could actually present with hypothyroid problems due to an autoimmune diseases, but the way to approach correcting their problems could be different, because we're different, and the way we approach health in our body is with uniqueness, that every individual needs different things and live in a different environment, have different genetic makeup, so everybody is different. So we approach it from a different perspective with every person based on these different patterns that could be damaging their thyroid. Alright folks, I hope that actually clarifies some of the misconceptions out there about thyroid and get a better understanding of what's going on with your thyroid gland, because like I said, it's one of the most important thyroid gland in the body, and it's underdiagnosed and sometimes misdiagnosed altogether. And this hopefully gives you an understanding of how your thyroid gland works and what you need to do moving forward. If you have any questions, do not hesitate to post them on the comments below. We'll get back to those questions either with video or comments specifically. Please share this video with your friends and family. If anybody can benefit from this explanation to just have an idea what their thyroid is doing, and if they have been struggling with some of the symptoms like I mentioned, brain fogginess, loss of hair, brittle skin, nails, dry skin, excessive weight, need for extra hours of sleep, and so forth, please share this video with them to just give them an understanding of the importance of the thyroid, and if they need to ask their doctor to get tested. If, like I said, even if your doctor tests your thyroid, they will normally test the TSH, but that doesn't tell us more or less about your thyroid. But to get a comprehensive testing is you can visit one of our clinics across the country, the Wellness Way clinics, and the website for that is www.twwclinics.com. Again, twwclinics.com to get a very comprehensive testing and understanding of what's going on with your thyroid gland right there. All right, folks, Dr. Fawaz again from the Wellness Way in Pleasanton, and I hope you have a wonderful day. Thank you.